hand if you've checked off one or more things. One or more. Okay, that's a lot of the room. Okay, so first of all, I'll just say that's not uncommon. It's not okay, but it's not uncommon, because I want you to realize those kinds of symptoms are dangerous signs of other things going on in your body or things developing in your body. For example, sciatic pain. Sciatic pain is a common symptom that people dismiss. They'll take muscle relaxants for, or they'll take medications to cover up, which is just like putting a tape on the dashboard of your car when the lights are. That's not a good idea. Okay? Don't suggest that for anybody here. But what happens is, actually, sciatic pain increases your blood pressure 10 to 20 points. People don't necessarily realize that. And if they don't have the pain, they can still have the nerve pressure, but not producing a symptom, and their blood pressure could be up 10, 20 points just because the nerve pressure is there, even though it's not producing pain at that moment. Another one, asthma and allergies. Asthma and allergies are very related to stress, because asthma and allergies are pretty much a sensitivity that produces inflammation in a person's body. When a person has a lot of stress that they're not recovering from, they have more inflammation. And they have more asthma and allergies. And as stress is increased, they increase those. And when people's stresses decrease, they have less asthma and allergies. Migraine headaches is another one. Migraine headaches actually physiologically can mimic, in an EKG, can mimic a heart attack in terms of that, as well as a person's rise in blood pressure. So a lot of these things really interchange. Sinus problems. Sinus problems is a huge sign of a depressed immune system. Interesting thing about depressed immune system, your immune system does things like it fights off colds and flus, right? But it also fights off things like cancer. Everybody in this room has anywhere between 5 and 10,000 cancer cells in your body right now. But your body is constantly fighting them off, keeping them in check, and lowering them, keeping them safe levels. When your immune system is depressed, guess what? It doesn't do that as well. You'll have colds and flus more frequent, but you're also more susceptible to more serious immune disorders because your body is stressed. Okay? So 7 keys to overcoming stress. One is exercise. Exercise is a tremendous stress buster. 2, meditation. And excuse me, I will clump into this for meditation, prayer, or silent time, or whatever your term is, okay? But getting some peaceful time for yourself. Think about this. I read this term in a magazine, having unstructured time. And I said, wow, I couldn't remember when I had unstructured time, okay? But trying to get 15 minutes of unstructured time, then you think, well, if I'm structuring unstructured time, is it really?
Then you're structuring.
Then you're structuring it. But you get the idea,
and then
okay?
you get stressed because you missed your unstructured time.
Which leads you into time management, okay? So time management is another huge key to reduce stress. And I want to help you with a visual aid that served me very well, that I think will help everybody in this room, which is that, let's use you for example. You drive?
Yes.
Okay, good. Do you know there's double yellow lines in the road?
Yes, I do very well.
Okay, good. We're all happy about that. Which side of those do you stay on?
Right down the middle.
Usually the right.
Usually the right.
Usually.
Usually, okay. Who said right down the middle?
Right down the middle.
My father-in-law does.
Right in between.
In between.
And I'm sitting in the back seat like, and he's right down the middle the whole time. Curvy blind roads. So yeah, the right side, okay? Everybody has that pretty much as a good visual in their mind that double yellow lines mean something. Time management. Use that to serve you. When you have things that you're doing in your work time, draw a double yellow line around it that this is what I'm doing here. Family time, draw a double yellow line. I'm walking into my house and I am switching gears into this other side of that double yellow line, and I'm not putting other things there. I'm not sitting with my BlackBerry at the dinner table or whatever it might be, okay? Because that is increasing your stress. You're definitely not getting into your unstructured time, your family time, or whatever. Expressing the things that you've held on to. It's the things that you hold on to that you hold in your body that continue to increase stress. Laughter, taking breaks, healthy nervous system is a huge key that I'm going to focus on in just a few minutes too. What is optimal health? Important to define that for people. Optimal health, according to the World Health Organization, is optimal Physical, mental, and social well-being, not merely the absence of disease and infirmity. This is what has gotten us into a health crisis in our country. People thinking, if I don't have a disease and I'm not sick, then I'm healthy. Nothing can be further than the truth. I probably couldn't say I have a month go by in taking care of patients that have someone tell me, either a current patient, someone who's coming in to see us, or someone that's a relative that says they were 30, they're 40, they've never been sick, they never have anything going on, and they have cancer. And you probably all know people that have experiences with that. The reality is you have to take an active place in taking care of your health every single day. Healthy people make healthy choices, and you got to kind of take a stand that you determine what kind of body you are going to have in terms of your health and well-being, not someone else. It's not dictated. It's not set in the stars. You have tremendous control over that. And I want you to think, what is wellness? Wellness is the degree to which an individual experiences health and vitality in any and every dimension of your life. So, are you healthy? Are you just not sick? And where are you on this paradigm? There's death and illness here, and wellness and optimal health. And you want to think, where am I facing? Am I facing this way and moving more this direction? Or am I facing this way and moving that way? That doesn't have anything to do with age. It just has to do with how you take care of yourself every day. What picture you have of yourself in terms of your health and well-being. Talking about pictures, that is myself, believe it or not, and my wife. I was our engagement picture like 12 years ago, but I still like using it until people say it really doesn't look like us anymore. So our specialty is network chiropractic. We do a special advanced approach to chiropractic care. We have a wellness center in Boulder. That's its location, and I'll talk about that in a little bit. But your central nervous system is what we focus on because it helps people handle stress. Your nervous system is what adapts you to stress. You're a master system of your body and controls every cell, tissue, organ of your body. Your central nervous system is made up of your brain, your spinal cord, and 12 miles of nerves that go to every cell, tissue, and organ of your body, which is like from here to Costco. So that's pretty far. And only 10% of your nerves have anything to do with sensing pain. This is something that people don't realize. Remember when I said people can have conditions like cancer and not necessarily have pain, or diabetes? You can I'm sure any of you could shout out 5 other conditions that don't have pain. Your spine is no different than any other part of your body. There can be problems in it, but you may not realize it because only 10% of it has anything to do with sensing pain. Okay? So people really need to take care of their spine in the first place because it's the control panel of their body. 70 to 80% of all health conditions can be traced back to the spine. They've actually done autopsy studies, medical autopsy studies, to show that. So really to be healthy, a person's core, their power plant, their spinal cord and its column needs to be functioning well. So you've got your brain, your spinal cord, and the nerves that go out to every cell of your body. This is a model. It's not like from someone who didn't make it or something like that. Okay? So when people have changes to the alignment of their spine, or if they have curvatures of their spine, it presses on those delicate nerves. It's not about what it does there, okay? It's not about a person's back, that if there's pressure that's producing something there, it might, but it's about that nerve goes to somewhere. And then that part of the person's body is weaker. And that's a weaker part of the body. That person loses their ability to be healthy and well. And those organs or tissues or cells slowly become more sick. And then people have inflammation, they'll have infections. It might be the